All right, hey crew, what is up? My name is Dr. Trissa Hutchinson. I'm an occupational therapist with the Institute of Clinical Excellence in the Older Adult Division. Welcome to the Modern Management of the Older Adult podcast. I am so excited to speak to you guys tonight about exercise in disguise and how to increase your patients' overall participation, specifically with those individuals who have dementia, are living with dementia, or those patients who just don't like to exercise. They, in your session, just don't want to participate. It's not their jam. And how do we increase and get those people moving and grooving again? So where this all came about and why I want to really talk and deep dive into this is I recently had some conversations, and it's very common to hear that, it's super frustrating for physiotherapists that we have that one patient who we just can't get them to do anything. There's no goal directed behavior by the patient. They just, the person, we go in, we try, but they just don't want to push hard, or they seem like they're always trying to chit chat and get distracted or try to get us off topic. And they're not motivated to participate in what we want them to do or what we know they need to do to get back on their feet or reach their goals. Now, I totally understand that, and it can be super frustrating to run into a patient who is acting this way or showing signs, symptoms, behaviors that are kind of in this like unmotivated or kind of delayed progress type of scenario. But I want to flip the script, and I want to kind of call out our profession, and I want us to look in the mirror at how we, as occupational therapists, as physical therapists, as, any rehab professional, how can we dive in and change what we're doing to make the task, the intervention, more applicable for our patient? How can we take ownership of our session to increase participation and get off our high horse and make it meaningful, make it matter to our patient so that they are more likely to want to participate? So taking ownership of our patient's participation a little bit more. Okay, so in the older adult division, we dive into an awesome framework that Julie Reese set out in 2022. She talks about a framework for rehab professionals, specifically working with those who are living with dementia. And one of the principles that she deep dives into is this motor learning principle, and further talks about the benefit of having saliency to task and making sure that our interventions matter to our patients. And I could not agree more. When we talk about using intervention and exercise to help our patients, it's fantastic, right? We preach over and over that older adults are strong too. They need the intensity. They need to be doing the squats, doing the deadlifts, the overhead presses, the snatches, all of the things. They need all of those too, just like yourself and myself. However, if they do not understand what the point is, they're less likely to participate. They're less likely to care, okay? So we need to make sure that we are connecting the dots for them. Connect the dots for them. Correlating an exercise to an occupation is very tough to comprehend. You and I may know that if I am doing a goblet squat for reps and I'm getting down and I'm using heavier weight and I'm progressively overloading, that might make sense in my mind that I'm going to be able to get on and off the toilet easier. I'm going to be able to get in and out of the car a little bit more simple. Maybe when it comes over to the stairs, I've got no problem. I can get up, I can get down, all of the good stuff. But for our older adult, they may have no idea why I'm carrying this heavy weight thing that some young buck therapist walked in and handed me this thing and told me that I have to sit down and stand up or bend down and stand up. And what's the point? What's the point? So The first call to action is I need you all to tell your patient what you are simulating. What is the point of your exercise? Why are you doing that thing? And what occupation is it going to help them with? How is it specifically relating to their goal? If you cannot tell them why the exercise you chose correlates to an occupation they're doing or their goal, then why are you doing that exercise at all? It should be specific. When you're picking your interventions, they need to matter, they need to be meaningful, and they need to correlate to your patient's goal or occupation that they want. Okay? But call to action number 2. Better than saying or telling them what you're simulating, don't simulate, just do. Actually do that occupation. Bring whatever they want to do, whatever is meaningful to them, bring that into your session. What I mean by this, your patient wants to get on and off the toilet and they want to do it better, then go to the toilet and have them stand up, sit down from the toilet. If you want to load it up, the more power to you. I've had many people do box squats or goblet squats, holding a heavy kettlebell, literally getting on and off of the toilet. Make it make sense in their mind. If you have someone who wants to carry their groceries in, then put items that look like groceries or groceries from their house, or grab the things, put them in bags like grocery bags, and do your loaded carry with the actual objects that mean grocery, or that you would carry for groceries. So do the actual thing. I'm going to keep going through multiple examples. When gardening, I have a lot of patients who love to garden, and there are so many interventions that we love to pull out for gardening, right? Oh, our patient needs to work on rows, okay? Or they need to work on their grip strength, and we're going to squeeze something heavy or something like that to try and get their hands stronger so they can cut weeds or trim or do something like that. Why don't you just actually get some dirt, get some plants, and practice actually doing that task? Why don't you go outside, find some grass, find some weeds, and practice pulling the weeds out of the ground? 2 birds, 1 stone. You're actually maybe doing some landscaping work too. But what I'm getting at is figure out a way to do the thing. Figure out a way to do the thing. If your patient really wants to climb the stairs, then go to the stairs and climb them. Rather than doing the box step up, bring them to the actual stairs. It doesn't just work for those patients who are unmotivated. It also very, very much so correlates again to those people who have dementia. It's hard to get someone to stand up, sit down, stand up, sit down. It's hard to have someone hold a dumbbell and push it up and down over and over if they don't understand why. So make it look like the real thing. I've put weights inside of heavier or bigger cups or water bottles and had my patient repeatedly put the water bottle or the cup up on a shelf. They're doing their overhead press, but they think they're just helping me clean up the kitchen or clean up the cabinet or clean up the counter space. It matters to them. I had an individual who really was sick of having back pain when she was sweeping the floor. So yes, we leveraged multiple different interventions to help get her back stronger. But we always ended the session actually sweeping the floor. We leveraged progressive overload, and I applied weights to the end of the broom, so she was doing weighted sweeps. But she could see the direct correlation of how she was getting stronger doing the task she wanted to do. Now, I understand sometimes our patients are in a situation where a lot of occupations are like done for them, or they have a lot of assistance. Maybe it's someone who is in like a memory care facility. Their dementia has progressed far enough that they need more assistance. So having them do some of these tasks may be super challenging. We might not have the resources out there Someone might not have the opportunity to do some gardening or go outside in the grass. I understand. So then pick something that matters to your patient, something that's fun, and make it a game. Make it look like something they care about instead of just rote exercise. Just today, I was working with an individual and she very openly told me, I hate exercise. If you tell me to exercise, I'm probably not going to do it. And it's not that I don't want to get better. I just hate exercise. So what we did was we found something she loved, which was doing puzzles. We set up a table that was up high so she could stand. One of her goals is to stand longer and walk further in specific reasons. But she stood at the table, and every time she got 3 or 4 puzzle pieces put together, she would go and stretch her legs and take a lap around the kitchen. Okay, so she no longer thinks that she's just doing exercise. She thinks she's just stretching her legs so she can get back to working on her puzzle. Okay, I had one individual who I know needed to work on deadlifts and squats, and I could not get him to participate in exercise. So rather, I dug in, found out what he enjoyed most, which was hunting. He used to be an avid hunter of both birds and like elk, moose, deer. And so what I did was I printed off large pictures of animals that he would have hunted back in the day. And we taped them up on a curtain or a wall, depending on where we were doing our session. I gave him a Nerf gun and he got to work on his balance, stepping and trying to shoot this Nerf gun at these different targets. But then he had to go bend down to the ground and pick them all up. So I incorporated that movement into something that he wanted to do, that he enjoyed doing, and he was laughing and had no clue that he was actually working on the bending portion, reaching down to the ground and standing back up. Great way to include this is if someone is participating in some sort of occupation, like maybe doing laundry or making their bed or something like that. I incorporate rest breaks and, let's just sit down and take a little breather. What they don't realize is that I'm incorporating sit to stands into their session, but I'm disguising it. So in all, my call to actions for you guys. Number 1, say what you're simulating. And number 2, level that up and just do the occupation. Do the thing. Make it meaningful, make it salient, make it matter to your patient. It's your job to connect the dots. Have a great evening. Thank you so much for hopping on.